Can everyone hear me? Wonderful. All right. Good morning, everyone, and welcome to the UT Health Back to School virtual panel. We will get started in a moment. We will allow for brief presentations by our experts, and then we will open up the floor for questions after. So our very first speaker is going to be Dr. Michael Chang. He is an infectious disease pediatrician with UT Health, UT Physicians, and Children's Memorial Hermann Hospital. And I will go ahead and let him take it away.
So I'm going to primarily be covering the clinical aspects of COVID and the Delta surge that we're seeing now. So generally speaking, two COVID syndromes bring children to the hospital. The first is acute COVID with respiratory disease and other signs. And the second is multisystem inflammatory syndrome in children associated with prior COVID infection. So with respect to acute COVID disease, what I mean by this is children presenting kind of with the expected symptoms of COVID. So the primary ones being fever, cough, and respiratory symptoms. And these can be very difficult to distinguish from other respiratory viruses though. And I'm sure many of you are aware we have been experiencing a surge in another respiratory virus known as respiratory syncytial virus. However, at least at Children's Memorial Hermann Hospital, what we've primarily been doing is we've been testing for all respiratory viruses in children presenting with respiratory symptoms. And so what we've seen is we've definitely seen an increase in pediatric patients presenting with symptoms due to COVID alone. So up to the Delta surge, most of our pediatric patients were actually asymptomatic patients that we detected through surveillance screening of all hospitalized patients. And so this is definitely a change with the Delta variant surge. Most patients are still teenagers. Many are obese, and these are the same patients who have been noted to be high risk for severe illness throughout the pandemic. However, we are also seeing an increase in previously healthy children that are preteen or younger, also being hospitalized for severe COVID illness. And we've also seen some infants with severe COVID infection. So another change that we've anecdotally observed are more family members within the same household are requiring hospitalization, such that some children are being brought in by extended family because the primary caregivers are all receiving care themselves. The second reason that a pediatric patient may come to the hospital for COVID-related illness is multisystem inflammatory syndrome. This is a post-infectious syndrome that appears to be triggered by the immune response to acute COVID infection. The exact physiology of multisystem inflammatory syndrome is unclear, but the symptoms are high fever, heart inflammation, and possibly heart dysfunction, like myocarditis, and then potentially injury and inflammation in other organs, including the liver and kidneys. And what's concerning is that even children with previously mild or asymptomatic COVID infection seemingly can develop this multisystem inflammatory syndrome in children. So far in the United States, about 1 in 1,000 pediatric patients have developed MIS-C or this multisystem inflammatory syndrome following COVID infection, according to data from the CDC. And so since we're seeing a surge of COVID infections right now, and likely even more in the community that are not necessarily being diagnosed, we may also see a surge in MIS-C cases over the next several weeks too. MIS-C generally has an onset about 4 to 6 weeks following COVID infection. So at this time, luckily, generally our children are generally still doing well with COVID infection, but rising cases secondary to Delta are very concerning. And the cases do seem to be a bit different than what we have previously observed in pediatric patients to this point in the pandemic. And it's also important to keep in mind that at this point, pediatric deaths due to COVID and MIS-C combined are actually greater than deaths due to seasonal flu over the last 2 to 3 years. And with that, I'll end my portion of this session.
Thank you, Dr. Chang. Next, we will be hearing from Dr. Caitlyn Jenellina. She is an epidemiologist at the UT Health School of Public Health in Dallas, and she is the founder and author of the well-known blog, Your Local Epidemiologist. Dr. Jebelina, when you're ready, go ahead.
Hi, thanks for having me. I threw together a few slides. It's a little easier to describe the pandemic with pictures instead of words. So let me share my screen. And Wendy, it says I can't share my screen.
Okay, one moment. Let me go ahead and pull up your presentation, and I will share that with the group. Are you? Okay, and there we go. Oh, are you able to hear? Oh, you're on mute, Dr. Jebelina.
You would think by now I would get used to unmuting myself. You can just click through this slide, Wendy. So the purpose of this slide was really just to explain that, Delta first was detected in December 2020. WHO called it the fastest and fittest variant, and we are certainly seeing that take place in the United States. The end of July, Delta was the cause of more than 80% of new COVID cases in the United States. Next slide. And Delta is really changing the game. And there's a couple reasons it's changing the game. One, it is 200% more transmissible, which means it is more contagious. It is more contagious than the previous variant. It's more contagious than smallpox and about the same contagion as chickenpox. So on average, one person infected with Delta will infect 8 other people. And before it was about 3 or 4 other people. And so it's doubling in contagiousness. Next slide. The other, changing the game is that patients with Delta have 1,000 times the viral load. So what this means is if you test positive, you'll test positive more quickly. And then also you'll shed a ton more virus. So if you come in contact with a positive, the probability of getting infected increases. The other thing that we just are figuring out with Delta is that there's a longer duration of shedding, that you will spread the virus a whole lot more. On average, for unvaccinated, you'll spread it for about 18 days compared to previously, which was about 13 days. And so this is also not helping transmission in the United States right now. Next slide. The other change that Delta has brought is the impact on the vaccinated. And so this, you can click again, Wendy, showing that the viral load among the vaccinated is about the same as on the unvaccinated. And so how this changes is that people with vaccine can transmit the virus almost at the same rate as the unvaccinated can. And this study was really what prompted the CDC to implement masks among the vaccinated indoors. Next slide. The good thing, though, is that we continue to see that the vaccine still protects against severe disease or death. A few weeks ago, out of 161 million people, there were 65 breakthrough cases and hospitalization or death. So it's very rare for someone who's vaccinated to end up in the hospital. The other great thing is Kaiser Family Foundation found that unvaccinated account for about 92% of cases in Oklahoma and close to 100% of cases in Connecticut. And so we're continuing to watch this very closely, but evidence so far in the past month have shown that the vaccines continue to hold up against Delta. Next slide. So what does this mean for children? Dr. Chang, brought this up on his last presentation, but what we're seeing is, one, hospitalizations continue to be the lowest among kids, which is fantastic. The problem is that we are all in a wave and the kids aren't protected from that wave either. So this is data I pulled this morning showing that child admissions are the highest they've ever been throughout the entire pandemic. And this is at a national level, so you'll see that on the graph to the left. But then we also see it in the hot spots. So Health and Human Services Region 4, which is Florida, a lot of the South Alabama, their pediatric admissions per 100,000 is out the roof. It's really impacting a lot of kids in the South right now. Next slide. This also means, so that's admissions, right, and death. And this also means, though, that long COVID, so morbidity is going to start impacting kids a lot. And unfortunately, we just don't know the prevalence of long COVID, especially among kids. There's a lot of different ranging numbers from the science, and so we continue to learn from this. For example, some studies have shown that, hey, there's no risk to kids about long COVID. On the other hand, on the other side, a study from Italy showed that 50% of kids have long COVID. And so this range vastly differs, and which tells me the true likelihood is somewhere in between here. The UK's official estimate of long COVID among kids is 7 to 8%. And that was so high for them that they have started opening pediatric long COVID clinics across the United Kingdom to help kids with long COVID, which can be, vastly ranging from heart problems to brain problems to liver problems to kidney problems, et cetera. And so we are happy that morbidity or mortality continues to be low among pediatrics, but we're continuingly also and increasingly worried about long COVID and what's going to even pop up in years to come. Next slide. What does this also mean for children and for schools opening is that children are direct vectors of transmission. So even if they aren't getting really severe disease, or the majority aren't getting severe disease, they are spreading it. And they are not helping with transmission decreasing in the community. Can you click one more time, Wendy? And we've seen this study and study again. So one study from the CDC came out showing that at 2 childcares, 12 kids got COVID at these childcare centers. 3 of them didn't have symptoms. The others, had very mild symptoms. But what these 12 kids did was they brought it back home to their families. And this even required one of the adults to be hospitalized. And so we know that in order to get control of this pandemic, we also need to stop transmission among kids. Next slide. So how do we do that? Well, we need a lot more kids vaccinated. Obviously, kids under 12 aren't eligible to be vaccinated yet, but kids 12 and up are, and not enough of them have a protection wall. And it's about, I think it's about 30% of kids are fully vaccinated. The problem is also this is highly variable across race and ethnicity. Black children, for example, are way less likely to be vaccinated compared to Hispanic or Asian children. And so this continues to impact the equity around COVID disease and transmission in the United States. Next slide. And so what also does this mean for children? Everyone needs to mask up indoors. Masks do provide inward protection, and that's a misunderstanding a lot of parents have. They do protect the child, even if other children are not wearing masks. But this is highly dependent on fit and filter. So the best type of mask is an N95. The next would be a double mask, so a cloth over surgical. And then the next is a knotted surgical mask is the next best, with 65 reduction in exposure. And there's a picture of it on panel C of a knotted mask. And then, even the loose fitting cloth masks, the protection is low, but it still helps a little. Estimates show about 40% of the cloth masks help with reduction in exposure. And so, to me, that tells me that it helps. It's better than nothing. Next slide. The other thing we know is that masks work really well in stopping transmission in the community, but also stopping transmission in schools. So study after study shows the effectiveness of layered approach in K through 12 schools. For example, in Missouri, they implemented masks last year. And they found with masks and physical distancing and ventilation, they had much lower transmission in schools compared to the community. We've also seen this in Utah, where they couldn't keep student desks more than 6 feet apart, but because they had high use of masks, there was low transmission and actually no school-related outbreaks in 20 Salt Lake County elementary schools. And we also saw this in rural Wisconsin from another study. And then even we saw this in another study in Florida. So we know that this layered approach works, and masks is a very important layer to this approach, as well as vaccines. Next slide. And so what does this also mean for children? When I talk to families, when I'm on my blog, I make it very clear that this means also, we're all on a different risk tolerance level, but this means that it's time to be more conservative if we're in these surges. So for example, I was a very yellow parent. We went on flights. I let them play in outdoor activities like pool time. But now with the Delta surge, I've become more conservative and gone into really the green area. And so we can also, tell parents that we can guide our activities outside of school too, to help lower transmission in the community. And that's all. Sorry, Wendy, I know I went over 5 minutes, but that's all that's all the information I have.
No worries. Thank you so much. All right. Next, we will welcome Dr. Christian Zinni. He is an associate professor of psychiatry in the McGovern Medical School at UT Health and a child and adolescent psychiatrist at the UT Health Center of Excellence on Mood Disorders. Thank you.
Good morning. Reason why we're including psychiatry in a talk about COVID, right, is because we've all been feeling like the emotional burden of both COVID and also of having people sick, and also of the measures that we've been using to prevent COVID. And what I'd like to share with you guys is that we've been seeing like a very, very, very huge increase in hospitalizations and visits to emergency in children and adolescents that has been associated to this period of time. So CDC has reported that kids younger than 11 have been seeing increasing 24% in kids from 5 to 11 and up to 51%, for example, in kids and girls that have been visiting ERs. And we are only talking about suicidality behaviors. So suicide can be prevented. And it's one of the worst outcomes we can have in mental health and in health. So we really want you to know that it is increasing recently. I'll show you right now the graphics for what we observed last year. I hope you can see the graphic. This is the increase we saw in suicide attempts in our hospital, which is the major county hospital in Houston. And the rates of suicide attempts in Hispanic kids visiting our hospital has increased significantly from 20% to 55%. So it became a significant problem. So how to prevent suicide? For when you're a parent and you're dealing with your kid, first is to know your kids, see the warning signs for suicidality. First, and remember, right, we're dealing with a situation where kids are isolated at home, or they're going to school and feeling exposed to COVID, but nothing is the normal anymore. So first you try to go back to creating a routine in your house and explain to them about COVID, how to be careful. I'm very happy to hear that masks also work very well in schools. Right, we just heard that. And once you do that, you need to be observing your child for changes in their behavior. So if you notice your child is not sleeping as they did before, or if they're crying more tthan usual, if they start complaining about physical problems, they're not feeling well with very unspecific complaints, if they're having problems with when they were having school, doing their schoolwork, any change that can be explained by these recent changes in all our lives. Those should trigger your attention that your kid may be suffering from some mental health problem associated with COVID. Once you identify those, the things you can do to help your child are increasing their networks, their social connections, talking to other friends that are going through the same situation so they can share their coping skills with this. Also, one thing that is really, really important is to hire firearms, and remember that over-the-counter medications are usually one of the favorite drugs kids use to try to commit suicide. So please lock all the medications you have at home, like Tylenol, Advil, any of those. And also be very aware of spending more time with your family to share with them how you are feeling, how you're dealing with the changes, and help them cope with that as well. It's really important to tell the kids that they will, that this is a crisis that will end at some point, and we can figure this out together, helping each other and making each other safe. If you guys think, if parents need help, if they identify their kids are changing to the point that they need more help, we can ask them to look for resources like any mental health provider, psychologists, therapists, school counselors. There's an initiative by Texas, the UT is part of it, the Texas Child Health Access through Telemedicine program that provides short-term care for kids with mental health problems. I'd be glad to share those later. And again, I think the main thing is for all of us to realize that we're all going through a rough patch, and going back to school right now with all these changes caused by this new variant is unknown, and we know that unknown generates fear. And it's important when we're facing fear to use the best skills we have to face it, to face any danger we know. So sharing these feelings with your kids and your family and doing what everyone should do, which is getting vaccinated, masking up, that is fundamental. And again, if you identify any significant changes in your child behavior, emotional behavior, look for some help. Thank you.
Awesome. Thank you so much, Dr. Zinni. All right, so now we will open up the floor for questions. And since there's several individuals on this call, what we will do is we will take questions through the chat. If you could just state your name and your outlet, and then we will open up the floor. Just don't want everybody trying to unmute at once.
Stephanie, I saw your question.
Okay, yeah. Would you mind answering it, please?
Yeah, so I'm not speaking officially for Memorial Hermann today. I'm speaking for UT Health, but in general, what I can tell you is that as far as kind of like the percent of hospitalized children that were being hospitalized for COVID, to this point, it's been like under 1%. But then in the last few weeks, we've had times where the percent of children hospitalized with COVID has been as high as 20%.
All right, David, you have a question in Spanish for Dr. Zinni?
Yes, I do. 1 second. Can you hear me there? Perfect. Well, Dr. Zinni, can you please, nos podría decir cuáles son las recomendaciones más importantes que usted le daría a los padres de familia para que los jóvenes ahora que van a regresar a clase se puedan acoplar ante esta situación de la pandemia y también si me puede hablar acerca de este problema del suicidio?
Ok. Para los papás, para los niños de suicidio, es para que puedan buscar recursos, pero de la pandemia para que regresen a la escuela, lo más importante los papás reciban la vacuna y también digan a la familia que es seguro y que reciban la vacuna también. Entonces eso es lo mejor. Y entonces que sigan usando máscaras cuando estén en la escuela y así como los papás pueden trabajar en eso cuando salen con los niños de la casa, que usen máscaras también. O sea, el mejor es el ejemplo. La segunda pregunta era de suicidio, ¿verdad?
Sí, decía que en el último año, en el 2020, se incrementaron los números de intentos de suicidio en los hospitales.
Sí,
¿Qué
en nuestro hospital, que es un
Ajá.
hospital psiquiátrico, solo vemos niños con problemas psiquiátricos. Antes teníamos como 20% de las niñas y niños que venían por quejas de suicidio que intentaron o estaban a intentarlo, y eso se subió a más de 40% de 2019 para 2020.
¿Cuáles son esos síntomas que yo como padre debo de ver en mi hijo para saber que existe ese problema?
Que se pone, por ejemplo, estar más lloroso, más irritable, sin que tenga una explicación por eso, si se aísla de la familia, si ya no quiere, no tiene ánimo de comer, no tiene apetito, si no, ya no duerme como antes, tiene dificultad para dormir, si empieza a hablar de muerte, si son las cosas más claras, ¿verdad? Si empieza a hablar, oh, ¿cómo es la vida? ¿Qué pasa cuando se muere? Y cosas así.
Y mencionó algo bien importante, que son los medicamentos y también las armas de fuego. ¿Qué es la recomendación que ustedes le dan si el padre ve que su hijo tiene esos comportamientos?
Bueno, yo entiendo que ningún niño debe tener acceso a medicamentos. Imagínate, por ejemplo, mismo si el niño necesita, por ejemplo, Tylenol, no hay una razón que el niño pueda administrarlo él mismo, ¿verdad? Los papás que tienen que hacerlo. Entonces, que encerren todos los medicamentos, así como las armas de fuego, lejos de los niños.
Muchas gracias, doctor.
Gracias.
All right, Bianca, for Dr. Jebelina, do families in areas with high vaccination rates need to be as concerned or worried about masking up their children in school?
Yeah, absolutely. Every county right now has high transmission in the United States. And so what that means is there is still a lot of disease transmitting around children. We just don't have the vaccination rates to have an effective immunity wall for kids. We don't even have a close one. Some scientists have said we need, about 90% vaccination rate, and we're not close to that. And so because we don't have that immunity wall, high rates of transmission, regardless of how high vaccination rate is in a community, which isn't high enough in anywhere in Texas, still needs to worry about wearing masks indoors until that transmission decreases.
All right, Dr. Chang or Dr. Jebelina from the Houston Chronicle. Are young adults experiencing different symptoms compared to kids and infants? Are young adults being hospitalized more often than the younger groups?
Dr. Chang, you want to take it?
Sure. So what I can say is that throughout this pandemic, young adults have been more likely to be hospitalized than young children. It's a little bit of two peaks. There was a little bit higher rate of severe illness, potentially requiring hospitalization in kids under a year. And then teenagers and young adults tended to have a higher risk of more severe illness requiring hospitalization. And so there is a bit of a difference between age groups. That age group between 1 year and maybe 10 or 11 years up to this point had relatively few hospitalizations and severe illness. As far as symptoms are concerned for the infants, most of what we're seeing at this point with the surge, the Delta variant surge, are respiratory symptoms. So cough, difficulty breathing, and with difficulty breathing comes difficulty eating potentially, so decreased feeding. And so those are kind of the symptoms that we're seeing in our younger infants. And then with teenagers and young adults, they have kind of the typical expected COVID symptoms: fever, cough, respiratory symptoms. And so those are the primary symptoms. Earlier in the pandemic, it was felt that pediatric patients had more abdominal symptoms, more diarrhea, more gastrointestinal illness and symptoms. But now with Delta variant, it appears it's kind of becoming more similar to adults with more respiratory symptoms.
Okay, we have a question from Hayley with KPRC, either Dr. Chang or Dr. Jenellina. Masks work, but what about kids who are in school or daycare but are too young for masks? Also, what is the most important thing their families need to do? And a third question, are vaccinated people spreading the virus as much as unvaccinated people?
Yeah, so these are really good questions. The first is, what's the most important thing for families to do if their kids are too young to be vaccinated? And I'm actually in this arena. I have two very little ones. And what they need to do is parents need to mask up indoors to help spread the transmission to the kids. And not only the parents, the teachers at the daycares need to do this as well, especially if they're unvaccinated. This is incredibly important. And it's actually a reason I took my two girls out of daycares, because I found out that their teachers weren't vaccinated and weren't wearing masks. The other thing, wearing masks reduces transmission, but it also helps with a lot of behaviors as well, both around the kids and then what the kids see. And then, are vaccinated people spreading the virus as much as unvaccinated people? We actually don't know the answer to this. So we know that vaccinated people have as high as viral loads as unvaccinated people, but viral loads actually doesn't exactly map up to infectiousness or contagiousness. And so we are still trying to figure that out. The one thing we also know is that vaccinated, even though they have a high viral load, at least in the first 6 days, they quickly decrease viral load once that vaccine kicks in, compared to the unvaccinated, which will shed the virus for about 18 days. And so maybe in the beginning they are, but certainly not over time. But we are still learning as we go.
All right, this one. All right. We had a question for Dr. Zinni from Bianca, but it has deleted from the chat. Can you please resend that? All right, Dr. Zinni, can you offer talking points to parents who will mask their child at school but are worried their child might be bullied or singled out?
Yeah, again, I think the best example parents may set is the example, right? And giving their children the reason why they think they should mask up, and show the kids that when they go outside, they will also be using masks, is the best example. But then I believe that the same reasons why kids will be bullied for other reasons, the same reasons that kids are bullied, that will include the masking, so if they're bullying because of glasses or whatever they use, it will be the same as masks. So it's the same recognition. If kids are bullying you, you tell them to be away from those kids, talk to an adult, and then the adults can help educating everybody else. Unfortunately, for sure, the division that we see in the adult community about vaccination, we'll be seeing the kid community because they copy the adult behaviors. So again, it's really important for their parents to strengthen their kids with their beliefs and understanding of the importance of vaccination and masking.
Right, do we have any more questions for our experts? Bianca, would you like to ask your question?
Sure. Hi, Dr. Jebelina. Do you want to try to tackle the herd immunity topic real fast, as if it can be done real fast? But, in Dallas County, we reached herd immunity and it made, headlines. But obviously Delta has changed all of that. Sorry, and this is why I was on mute. Thoughts on if we will reach herd immunity, if it, will ever happen, and what it might take to get there. And we can talk about kids as it relates to that as well.
Yeah, so I was really disappointed when I saw that hospital leader claimed victory about herd immunity, because that's not how herd immunity works. And that's a common misconception. You know, herd immunity isn't a light switch. So it's not like we're going to hit this magical number and then all of a sudden all of our cases will tank and we will just be able to go back to normal life. That's not how it works. What herd immunity is a policy goal. It's a goal that once we reach it and once transmission is low, it'll continue to help keep transmission low. And so no, Dallas County did not reach herd immunity, and counties won't reach this. It's a very population-based number. What happens in counties around them certainly impacts it. And so no, they didn't reach it, and I think it's very obvious now with all of the cases and hospitalizations. The latest number that I've seen from scientists is that we need about 90% herd immunity. So that does include natural infection to some extent, but mostly that will be covered by vaccinations if we ever get to that point. The vaccination rate continues to disappoint me. And so I honestly don't even know if we'll ever reach it. But it can be a goal for us. I don't know if that helped, Bianca.
All right, Hayley with KPRC wants to know, have any infants died from the virus?
I can't comment on any specific cases, but across the country and in our region and state, there are infants who have died from COVID-19.
Wait, can I follow up on that?
Okay.
I'm sorry. I wasn't sure if you could hear me. Yeah, so we aren't getting good data on the infants. Do you know about how many or if they had underlying conditions? I'm not asking for a specific case, but just to know, to let parents know what's happening.
Yeah, I understand, Hayley, I understand the difficulty in getting data about infants. I think part of the problem is, fortunately, the number of cases in infants that have resulted in a death are few, but it's also few enough that I think even giving you, some basic information may result in some privacy concerns. So I think the best I can do is say that there have been, unfortunately, deaths due to COVID in infants. And I think, what we'll need to do is probably talk with all our different hospital systems and see how we can get that information out in a meaningful way, but that also doesn't violate any privacy concerns for families.
Hayley, the other thing I wanted to add to Dr. Chang's ideas was that CDC continues to say that kids under 1 year old are at high risk for COVID. So they are considered a high risk group, just like obesity is, just like asthma is. And so what that message is to parents is that if you have a kid under 1, they need to be extra vigilant for COVID and for who's holding the baby and who's really around that baby until we can get a better understanding.
And I can point you to a publication that was actually very early in the pandemic. There was an infant published in the New England Journal from this region that did die from COVID. And this was before Delta even, this was like a year ago. So, yes, we've had infants die from COVID, and that's even before Delta became an issue.
Just one more thing that I wanted to clarify and see if you could talk about, Dr. Chang. A lot of parents are going to watch this, and a lot of parents are concerned as their kids are going back to school. But I just kind of want to reiterate, who are the children who are most at risk right now? Which parents need to be extra vigilant? And I think what you were saying earlier is that most of hospitalizations are going to be older kids, teenagers who are obese, right? Is it primarily kids with underlying conditions?
Yeah, so we are still seeing that trend. So it's still, kids that are being hospitalized for COVID illness are still primarily teenagers who are obese. And again, that's been kind of a risk factor that's been well known. And to keep in mind that these age groups, these 12 to 15 and older, they are eligible for vaccination. So if you have a teenager that falls into a high risk category, meaning having underlying conditions or is obese, and you're older than 12 years of age, one of the best things you can do is still to get vaccinated. And I know school's starting soon, but the sooner you can get vaccinated, the better. Again, infants, as Dr. Jenellina pointed out, infants have been a high risk group as well. And so, we have seen some infants hospitalized with severe COVID. And so, so those are still the primary risk groups. What is a little bit different is because of this surge and because of the number and how contagious Delta is, what we're seeing is there are more kids who have no underlying conditions and kind of in between those high-risk age groups that are being hospitalized. But the majority of hospitalizations are still in teenagers who are obese or have maybe asthma and potentially other underlying conditions. So those teenagers and the parents of teenagers should be, aware that they're in a high-risk group and that they should seek out vaccination if they can. One other comment I'll make about this is that when you look at what Delta has changed about kind of how the virus seems to spread amongst kids and within like households, very early in the pandemic, pediatric cases really were often documented to be like 2% of the total number of new cases per week, right? So underrepresented as far as how big of a population they represent. So if kids under 18 are like 22 to 25% of the population, if Delta spread equally amongst everyone, you'd expect the number of new cases to be roughly in that range. And early in the pandemic, that wasn't the case. Kids were kind of underrepresented with respect to kind of like new infections. But what we're seeing in our region now is that pediatric cases, and this is from Harris County's dashboard, pediatric cases like under 19 are like 30% of new cases. And so now kids are becoming kind of overrepresented with respect to how much of the population they make up. And so it's not to say kids are necessarily more contagious or more infectious or anything. It's just to say that kids are now being infected seemingly as easily as everyone else in the population, whereas we didn't necessarily think that before.
All right, if we have any more questions, please ask them. If not, I took note of who requested slides and sources, but if you did not mention the chat, you would like that, please email the media relations email address that you RSVP'd to, and we will get those documents to you. All right, well, if there are no more questions, thank you everyone so much for joining us. Again, if you have any other questions, please reach out to us. Dr. Chang, Jebelina, and Zinni, thank you so much for your time. We greatly appreciate it.
Thank you.
Thanks for having me. Bye.